So, in high ordnance mental abilities, concept formation, the child can develop basic concept, two object constancy, space, time, etc., and use their basis of understanding how materials are categorized in her environment. So, in 2 to 3 years old, knows the difference between recent event and what happened a long time ago. So, in 48 months, 3 to 4 years old can understand more and less and understand the concept of conversation of matter and rudimentary level. So in 49 to 60 months, um, 4 to 5 years old can demonstrate a concept of addition using the finger or object. So, in high organ mental abilities, cause and effect relationship, the child will be able to understand the cause effect of a relationship. In 2 to 3 years old, can understand the reason behind the rules and practices in the community, like those pertaining to sanitation and environmental preservation. Next, we have the memory. Next, we have the memory. When we say in standard one, the child will able to recall the people has met, events, and places he has been to. A 2.5 to 3 years old can talks about the things that happened during the particular event that occurred sometimes back. So in memory, memory for concept-based knowledge, semantic memory, it will able to a child to store verbal information in short and long-term memory. So 3 to 4 years old, it will memorize the lyric for short song and memorize the short rhyme. In 49 to 60 months or 4 to 5 years old, can recite a days a week with some errors and remember lesson learned in school even after several days passed. 61 to 71 years old, 5 years old, months rather. 5 to 6 years old can recite the days of the week with no errors and recite the months of the year with some errors. So, high ordered mental ability is able to follow the logic event. In ordered mental abilities, planning and organizing, able to organize, and highly ordered mental abilities, able to generate new ideas or concept. Then the higher orders mental abilities, cognitive flexibility, able to shift to more adaptive. And the role of caregivers. Now we are here in the role of caregivers, the parents and the teacher in cognitive development. So so learning about how preschoolers think and learn, one will realize that the parents and teacher can do a lot either to help preschoolers develop their cognitive skills and embed or embedded them with the best of intention. So for 3 years old, the teacher, the caregivers, the parents should encourage the interest in reading and writing by sharing a grocery list or note for parents, or for example for that, teachers encourage them a time to read. Also a parents and caregivers for 3 years old, because cognitive development will increase in in reading and writing. So provide them with the books, memorizing, and other guidance in 3 years old. In 4 years old, reading aloud of each day and encourage children to look at the books on their own. Guiding them also, provide alternative materials, no? Say teaching the importance of importance of reading, writing, numbers, and other knowledgeable. So in 4 years old, um, help them to plan and or plant the garden. So they will you will be able to know what their interest, so that you may guide them in the right way. So in 5 years old, a drama to your reading session, no, asking asking different questions after reading, saying or asking who tell the story, who's the author of the story, what's the flaw of the story, like that. Or uh, task them about writing about what they have learned, but in simple way, of course, because 5 years old pa naman. To sum up of the role of caregivers, parents, and teachers in cognitive development of preschoolers, it is important to encourage their interest, their develop more their cognitive development, and giving opportunities to learn new things in life, especially in cognitive skills. So that's for today's video, and thank you for listening.